Good morning, everyone. I am Dr. Sophia, Associate Professor, in charge of Medical Education Unit in Kadapa. Thank you for being all of you here. I start with a small introduction and we will go to the class next. So, welcome esteemed faculty and learners to this foundational course on medical education. As future educators, you will play a vital role in shaping the next generation of healthcare professionals who will provide high quality patient care. Medical education is a dynamic field that demands continuous innovation and improvement. Your role is crucial in fostering a learning environment that prioritizes patient-centered care, evidence-based practice, and lifelong learning. You will inspire and mentor learners to become compassionate, next, competent, and curious healthcare professionals. Throughout this program, you will explore effective teaching strategies, curriculum design, assessment methods, and feedback techniques. You will discuss challenges and opportunities in medical education, including diversity, equity, and inclusion. We will also examine the latest research and best practices in medical education, enabling you to stay current and adaptable in ever-evolving field. By the end of the course, you will be equipped with the knowledge, skills, and attitudes necessary to excel as medical educators. You will contribute to shaping the future of healthcare and improving patient outcomes. You will become agents of change, driving innovation and excellence in medical education. Let's embark on this journey together, committed to excellence in medical education. Let's collaborate, share ideas, and learn from each other's experiences. So, with this introduction, I go to introduction of this session by the ice breaking, and then we will go for a topic called as group dynamics. The objectives of this session is at the end of the session, participants should be able to witness interaction of participants and faculty, understand and apply concepts of group dynamics by working in groups. And if you can see over here, identifying the factors facilitating and hindering an effective functioning in small groups and generate opportunities to use group dynamics and in mental education to enhance students' engagement in learning. So we will go to the introduction of the faculty. Take your time, 2 or 3 minutes to introduce not yourself but the person who is next to yourself, left to your group. When the person is introducing, you just stand up so that you will be having your introduction to the total group here. Okay? Just because we are from different departments, we need the introduction. You take the name and then subject for dealing, that means the specialty and department where you are working, and you can conclude yourself in one word, whichever you feel appropriate for you. Take 2 minutes. Introduce your next person. 2 minutes. Sir, Madam will introduce sir, and Madam will introduce sir, sir will introduce that sir, and this sir will introduce us. Take 2 minutes. Yes, everyone is introduction. And group one, sir. Group one, please give your introduction. You have mic in your table. The time should be appropriate and have limited time, so be fast. There are many activities over here.
Morning everyone. Madam BCME is Sumati. She is from the Department of Medicine.
Madam, when you are saying, madam, so that everyone will see.
Sumati, she is from Department of Medicine. She is working as assistant professor in the Department of Medicine. She is hardworking.
Dr. Suresh Rege, Community Medicine Assistant Professor. His inspiring and motivational. Good morning, everyone. Dr. Suresh Rege, Assistant Professor in Department of Nephrology. He is very good.
Good morning everyone.
Group two. Madam, అక్కడే ఉన్నారు working, not working. Ishwar. Is it?
Good morning, everyone. Dr. Rajini Madam, Department Assistant Professor, working in Department of Physiology. Madam is very sincere and highly intellectual.
Good morning, one and all. I would like to introduce Dr. P. Nagajoti, Assistant Professor from the Department of Dentistry, Dental College. She is very friendly, hardworking, and humble.
Good morning, everyone. Madam name is Dr. Madhavi, Department of Anesthesia. Madam is very sweet and interactive. introduce Dr. Mohan Siddhartha sir. He's from Neurology Department. He's very sincere. It's a real patient.
I'd like to introduce my colleague, C.H. Bhaskar Rao. He is from General Medicine Assistant Professor as well as I think he's very nice person, hardworking.
This is Dr. Rajshekar Reddy sir, Associate Professor from the Department of Neurology.
My name is Dr. Shani, working as an assistant professor in gynecology. Madam is veterinary surgeon.
Good morning, madam. My name is Vijay Kumar. Is working as assistant professor in the surgery department. Is down to earth, is kind-hearted.
Sir, you have to listen other introduction answer.
Manoj Kumar, Super Science and Maths Department, is now there on this department.
Dr. Venkata Srivastava, working as assistant professor in anesthesia department. Sorry, sir,
That is Kavya, assistant professor, ambulance.
Dr. Mahida Reddy sir, sir is orthopedician, working as assistant professor at the Department of Anesthesiology. Sir is very sincere and hardworking.
Dr. Narayan Reddy, sir, assistant professor in the Department of Surgical Gastroenterology, Friendly and Talent.
Dr. Madhusudan Medicine, Senior Professional Professor in Orthopedics. Whole compost and special. Dr. Sheikh Ali Mehdi, working as assistant professor in microbiology department. He's Please, M. Rajshekar Reddy, Assistant Professor Department of Radiology. He is ever enthusiastic. Radiology is the heart of social science.
Thank you for your special introductions. Now we will move to the group activity. You are having one puzzle over there, sir. Most of you have kept them. You remove all those things and then again keep them. You will find one puzzle is missing. You have to see in which group it is present. You go to other group and then see in which group the puzzle is present. With the completion of two activities, we move on to the thing. So, first group is what is that you have observed in this group activity? The mind is whatever you want to say. Setting coordination and then whoever has been actively participating, they have been gone through the first and the B project. And so now we come to the PPT. The topic is group dynamics. What is a group? Group means two or more freely interacting individuals who are sharing a common identity and purpose. And what is group dynamics? Means the flow of coherent activities or events or communications which will be leading the group to set its goals. So there are many types of groups, mostly informal and formal. Informal groups which will be formed due to the friendship and acceptance, and then satisfy some needs which are called as esteem needs, which will be including the persons together by same hobbies or quality circle or any interest or sports like that. Those are informal groups. And formal groups, they are forming a group to do something which are productive, contribute to the success of larger organization. If two are there, that is a dyad, and if three are there, that is a triad. Small group will be consisting of 4 to 12 members, and a large group greater than 12 will be a large group. And then examples are a cricket team, like a cricket team, and then a singer group like BTS. Okay, then come to the group where the assembly of individuals will be gathering together. We be functional group where they are working together and committed to achieve a common goal. And effective group means they are diversified people, group of people with different complementary abilities, which will be of perceptives and then ideas or knowledge or skills or techniques or competencies, and then who collaborate to accomplish common goals for which they are accountable together. So So that is the effective group. And in a normal thing, there will be group leaders, group roles, which will be consisting of one will be acting as a group leader, and one will be a recorder transcriber, and one will be timekeeper, and one will be recorder. All should participate in discussion, and these roles should be changing, keeping on changing, not the same thing. So you can see whatever activity you have done, one is being arranging the puzzles, and one will be looking after whether the other group is doing faster than us or not, and one is assisting the leader who is keeping the puzzles like that. The roles should not be same as the group progresses, okay? So it should be changing accordingly. And there are 5 stage theory of group development, that is Luckman's theory of group development. After this slide, I will go for the light plummeting, and then we will continue the PPT. So what is Luckman's 5 stages? You can see here as forming, storming, and norming, and conforming, and adjourning. So these are the 5 things which you have seen now. Forming means we have kept the group to be formed. Depending on the criteria, the groups are being formed over here. And storming means members started to communicate their feelings but still view themselves as individuals rather than parties. So you have seen that stage while you are introducing yourself as faculty. Okay? And the next one is norming, where you are feeling a part of team and realizing that you can achieve, but they accept other viewpoints. That you will see when you are arranging the project. And performing the team works in an open and trusting atmosphere where flexibility is the key and hierarchy is important. So you have performed for a goal to get the puzzle made in first part. Okay. So that is what you can see, and then adjourning is the last thing. The team conducts an assessment of the year and implements a plan for transitioning roles and recognizing members' contributions. Okay. With this thing, we will go for the light sampling, and again we will come back for the. So I will complete this. So stage 1, forming members are attempting to orient to one another to given the task, and a group leader is appointed or selected by consensus. The leader directs, guides, and makes the group members comfortable, and the next rules of behavior to keep things simple and avoid complexity. And normally a group will be having a goal which is a smart, that is specific, measurable, achievable, reliable, and then relevant and timely, that you will be learning in this thing. And when you see this thing, the group discussion will be having a long-term retention, and then the stage 2 storming, where the conflict, difference of opinion, varying views, and contradictions will come, which will cause discomfort, and some members may remain completely silent, and while others may try to be vocal to get their ideas across forcefully. And normally, members needing to know, identify each other, growth of cohesiveness and unity, get involved in active discussion and problem solving issues, and they share ideas and give opinions and feedback to one another, and they really establish use of roles. And then performing, each member is task-oriented and each has an optimal solution and emphasis on performance and production, working in a group to a common goal at the center on a high efficient and competitive basis. And then adjournment, it is a terminal stage where the participation and achievement of each group member is conducted. So you can see over here why we are using groups in medical education. So these are the normal groups. So we are making the medical education learn better and actively involved, and there will be instruction teaching each other, learn more fully and with less effort, and learning context stimulates the real goal with using of the things. So what are the advantages of Development of lifelong learning skills, generic competencies allow students to develop generic skills and attitudes and desirable in the future practice. And then integration facilities and integrated core curriculum motivation fun for students and tutors. Fun for students and tutors, and the process requires all students to be engaged in the learning process. And you can see the deep learning which fosters the deep learning, and then you can see the constructive approach where the students activate prior knowledge and build on existing conceptual knowledge framework. And by group dynamics in any medical education. You can see here we can take it of the unmotivated students when they are performing as a group and take away spoon feeding and passive learning and effective when it is compared to a lecture. And the limitation of groups will be inexperience of the teacher and learner hampered group process and inadequate preparation and participation of all the members of the group. And you can see frustrating when members of significantly different levels of knowledge and skill, unpredictable in terms of outcomes, increases chances for interpersonal conflict. The another limitations are, you can see the human resources. There will be more staff have to be taking part in the tutoring process and other resources. The large numbers of students need access to the same library and computer resources simultaneously. And the challenges in our setup. So, this type of normal other lecture classes will be having this type of setup where the classroom layout will be having the spatial organization and the desks together with the traditional teacher, standard seating arrangement, the number of the students for a class, and then time constraint seat. Using groups in larger classes, using well-defined activities with clearly stated objectives, bring the class together for the discussion, clarification and frequent intervals. And then you can see here the group norms. You can see the group productiveness. Degree to which group members are attracted to each other. So when there is a bond between the members of the group and they are motivated in that group, that bond is called as the group cohesiveness, and this will be leading to the class of norms. You can see here in this slide when the cohesiveness is more. So you can see over here when the cohesiveness is more, when this is seen at this level, you can see the performance will be seen as this is the high cohesiveness with the high performance rate will be leading to the high productivity, and then the low cohesiveness with the high performance will be leading to only moderate productivity, and then even the performance is high, even the performance is low, and the cohesiveness is high, it also leads to the low productivity, and then both the members interaction with each other and performance will be low, will be leading to the low productivity here. And then group dynamics process, if there will be facilitating a group to be effective, the facilitator needs to understand what is happening in the group and be aware of his or her own personality and know how to facilitate the given session. And factors which affect the members' participation are the content of the task of the group. So, is it interested or important or relevant? And the physical atmosphere, is it comfortable physically, socially, or psychologically? And the psychological atmosphere, is it accepting or non-threatening? Members' personal preoccupations, are there any distracting thoughts in their mind? Like something is happening over there and you think headphones and the session is going on. And the level of interaction and discussion is adequate information provided for everyone to understand, and the familiarity between the group members, whether they know each other or not. Communication, helpful aids for the effective communication, have a circular seating arrangement like that. Now you are sitting. If there are two facilitators, they should sit apart so that communication flow is not in one direction. Respect individuals. Let everyone call everyone by name. Try and persuade the people to speak too much to give others a chance. Ensure that only one person speaks at a time and no one else will be heard. Discourage subgroups from interfering in the side talk. And then role of faculty. So consider what you want the students to learn or achieve. That means you have to set up your learning outcomes for a session. And next, choose a suitable set of group tasks to deliver the selected outcome. And step 3, decide how to organize the group. That means you have to prepare material, explain and check arrangement on tasks, and monitor development of tasks, and also control the time boundaries. The role of the group leader, a person who is not in a position of authority, who is outranked and is new to the organization and still be a leader, and managing or leading refers to a person's ability to successfully lead a group of people, and organizations have realized that more leading characteristics are needed to be more competitive in the workforce. So, group dynamics refers to the understanding of the behaviors of the people in groups, such as task groups that are trying to solve a problem or make a decision, and group norms are followed and collective cooperation is expected to ensure the effectiveness of the group here, and the group provides a measure of support and reassurance. Moreover, as a group, learners may also learn collectively for change action. So, this type of group dynamics is utilized in sessions like small group teaching, student-led group work, and then departmental meetings, and then MDU activities, and most administrative meetings, and many more, or wherever you want a small group has to look after a task. And this is the reference, and thanks to the acknowledgement from the NNC Executive Committee. And any questions? This is first session. That means first session meeting. We will go for the right planting now. All the curriculum sir. I invite Dr. Susan Sharma, NMC observer from CMC Vellore, Associate Professor Trauma and Surgery, and I invite all the curriculum members and resource faculty for the light lamp course.
I welcome you all to this BCME program. It is basic course in medical education. Most of you are having a lot of experience in teaching. Even then, I think it will help you if you follow carefully and effectively, and you need active participation. Okay? All the best to you all.
Madam. Okay.
Thank you.
Good morning, everybody. My name is Rizal. I'm an associate professor in the Department of Public Surgery in Christian Medical College, Fellow. Some of the faculty over here, some of the faculty over here would have seen us. We have worked together in different courses in medical education. And the National Council requires that all of us who run these BCME courses come input comes from model sciences. Now, Dr. Sophia has done a fantastic job to content with us. Let's give her a hand. Very good work. But the idea over here in these sessions is to make it more interactive. And since we have a little bit of time, I just wanted to ask you all, have you ever tried any of these things that we have talked about group dynamics in your classes so far? Or experienced it as a student? Anybody done, say, ACLS? Not the NFC ACLS, I should say, bad things for NFC, but yes, not that half day program that is just an eyewash. ACLS, ATLS, some kind of workshop, pre-conference workshops, small groups. You've done, what was your experience? Can you tell us how it was? This is important. Interactive session. Interactive session. Hands-on. You do hands-on things. So if you take a surgical training, whatever it is. Now when you go to a new place, like for me, this is very new. Now you know me. The first kind of thing you do is you get to know somebody. So we try to do some ice-breaking exercises. We try to get to know each other. And that's when couples theories come in, whether it's forming, storming, norming, performing, etc. That these are all concepts that are new to all of us. All of us are highly trained specialists in different areas. But all of us have a single mission, which the country wants us to teach medical students the same way across the country, which is based on the same competencies. At the end of the day, the degree that we're providing in this college, and in AIMS in Delhi, and in Jilva Pondicherry, and in Osmania and Hyderabad, is the same MBBS degree. And that consistency is what we are looking for across the country. I'm not a spokesperson for the NSC. I'm speaking as our passion in our college at Mobile Center to ensure consistent, good delivery of medical education across this nation. Those are the concepts that we're trying to introduce to all of you. Now, you may be a fantastic surgeon or a microbiologist or an anatomist or whatever it is, but these concepts are what will help you reach your medical student. Understanding how books form, how they interact with each other, that's what you all are going to do for the next 3 days. You're going to talk to each other, you're going to understand these concepts together, and we're going to learn together on how to do this. And this is with all adults, all of us are, I'm assuming at least 30 plus, or maybe younger assistant professors, maybe not so much. We're all adults, we don't learn like school children do. We have to interact, pay attention, ask questions, let us, all these fantastic faculty are here to answer every single doubt you have. If you have an idea of how you want to change your next class to MBA student, ask us. We will help you. We will help you figure out how to use these concepts, not only for the sake of your promotions. See, promotions come and go. Okay? At some point of time, we will all be professors. But there is no point being professor in such a good college if you are not able to deliver your job. After all you are here to teach. Otherwise, we will not be sitting in our clinics and labs and doing whatever else we want. We are here because we have a passion to be teachers to our medical students, to pass something on to the next generation. And we are hoping that this will help you understand. So, again, any questions about this previous session? If you have anything, please ask us. Even during the sessions, if you're feeling shy, I know it's the first session, it is difficult to hit the ground running, but please see what you can learn from this. Have any doubts, ask us. Have any thoughts and suggestions. If something doesn't make sense, I'll be very honest with you. I asked during acne why are we even talking about acne? It is philosophy from the 60s, it works in MBA, there are a lot of controversies about this government's 5-stage principles. But the thing is, medical education is clear that this is what is the current norm, this is what makes sense to teach people. If you ask me, has anybody done an interventional study and seeing if actually do forms like complex? No, the reality is no. Can there be evidence in medical education? Yes. Can it be valid? Yes. Can it be reliable? Yes. Can it be as scientific as figuring out one molecule and your answer? Yes. How to do it is what we are going to just get into further. But the ceiling is limitless in how to teach. And it can be quite exciting if you switch off your micro and add whatever medical range and try to look at it from a psychological and philosophical perspective. How do I get another adult to learn? And with the current generation, I don't know why X, Z, alpha, whatever it is, it's becoming increasingly challenging to connect with these things. I know that you all are having it, we are having it. I have difficulty talking to a post-tennis message. I cannot. What are you saying? I can understand. I cannot speak out in 3 seconds. So these are all realities that we have to adjust, and that is what we are going to try to do. Thank you. Please ask questions. Please interact. Depending on whoever the faculty is, maybe they'll be happy to stop this session and interact. But definitely during the session. So thank you. No questions.
Thank you so much, sir, for enlightening about the importance of medical education. Not only about knowledge about the medical field, but we have to inculcate this medical education principles in our teaching. Thank you so much.
After the group guidance session, there will be session on learning domains by Dr. Ramsagar Reddy sir, Associate Professor, BCME.
అందరూ రోజు నిద్ర వేస్తున్నారు ఇక్కడ కూడా మాట్లాడినా అలా చేయడం ఫాలో అయ్యాం బట్ ఇవాళ మాత్రం వే ఆఫ్ లెర్నింగ్ అది వీడిడి సిఎం చేస్తాం నేను చెప్పాను బట్ అట్లీస్ట్ మీలో మాట్లాడలేదు గుర్తుకోవట్లేదు ప్రయత్నం అనుకోవట్లేదు వైజ్ ఆర్ దిస్ సైలెన్స్ ఇన్ దిస్ గ్రూప్ సో వి ఎంకరేజ్ డిస్కషన్ ఆఫ్ ఆల్ సార్ట్స్ సో దట్స్ వై వి హావ్ మేడ్ ద గ్రూప్స్ టు బి from different departments, so that you will be having different things to discuss. About medical education, whenever we discuss something, what is going on, and what is my problem, what is your problem, so that discussion can happen there. Okay, so we encourage them actually. Okay, this time I feel we have so we encourage it actually. So others Telugu valle except the observer sir, I think all can understand Telugu and can better communicate, I think. Okay. So పిల్లలకి మనమేమి కొత్తగా చెప్పట్లేదు పాఠాలు పోనీ 3 రోజుల తర్వాత మనం చెప్పే కంటెంట్ అదే ఉంటుంది కానీ బాధ అసలు ఏంటి అంటే the way that we deliver. అది ఆ ఉద్దేశంతో ఏంటంటే మనకి ఎన్ఎంసీ పెట్టండి అక్కడ నుంచి రీజనల్ ఇన్స్టిట్యూట్ కానీ లేకపోతే మన ఇన్స్టిట్యూట్ వచ్చిన బేసిక్ కోర్స్ ఇన్ఫాక్ట్ అడ్వాన్స్ కోర్స్ కూడా ఉన్నాయి. బట్ in the help of these 3 days basic course, I think we may be able to get some change in delivering content to the students. Okay, so let's proceed to our session on learning process. So, is learning a thing that is being done in a single setting or in classroom? Okay, sir. Classroom lo కానీ లేకపోతే ఒక చోట కూర్చుని కానీ జరిగేదే లర్నింగ్ సార్? అవుతా సార్? ఇంకా కాదు. మరి ఎలా ఉంటుంది లర్నింగ్? ఎస్ సార్, దట్ ద బెస్ట్ థింగ్. సో ఇట్ ఈస్ ఏ కంటిన్యూస్ ప్రాసెస్ వేర్ ఇట్ స్టార్ట్స్. సార్ మా పుట్టినప్పటి నుంచి నేర్చుకుంటున్నాం, వచ్చే వరకు నేర్చుకుంటున్నాం. కానీ ఇక్కడ నేర్చుకుంటుంది ఏంటంటే టీచింగ్ లర్నింగ్ అని రాదు, మాత్రమే even that అది కూడా మనం ఎందుకు నేర్చుకోలేము కాదు. By being sitting as student also, you might be thinking how can we deliver it if given option to us. చాలా అనుకుంటున్నాం ఎందుకు స్టూడెంట్ సెమినార్ చెప్పేదా, సెమినార్ ఇచ్చినప్పుడు కాస్తంగా ఉంటుంది స్టూడెంట్స్ బీయింగ్ ఫేసింగ్ ద స్టూడెంట్స్. బట్ professors or associates or assistants, now it's the time to get some addition to this. Okay, for this session, what are the objectives? So, I do have 3 objectives to make you enlightened about these. So, at the end of this session, I expect you to be a little aware of these 3. First is define the learning domains. Second is understanding the basics of learning hierarchy. Different ways, but even in that way, what is the hierarchy? What are the different levels of learning? Next is use the principles of learning by teaching or learning. So these things. So what is a domain? Domain means madam దూరం ఉన్నారు. What's a domain? See, like a dimension. See, you are only learning. కానీ నేర్చుకుంటున్నాం కానీ అది ఏ వేలో నేర్చుకుంటున్నాం. They have different dimensions in learning. Like having some improving the knowledge by reading. That is one way. And the other way is learning some surgical skill or manipulation. That is a different type of learning. And the way we communicate with others. So in that way we can learn something. And there is one way to make ourselves like feel how we feel or how our attitude has to be and how we need to change in this way. So this is another dimension. So these dimensions are called as different domains. So what is learning? As said, it is a continuous process. That's the same. So learning is not a single thing, but it is a continuous process where what will be acquiring is the new understanding, or what we know, understanding, or improving knowledge, or changing behaviors, or improvement of skills, values, and changes in attitudes and preferences. And what are the ways that we can acquire these 3? All the behaviors, whatever we say. Either by studying, or reading, or by practicing, or by being taught by someone, or by our own experience. So these are all the ways we get to learn. Now, what is the sole objective of learning? Whether teaching or learning together as a process. The sole is to change the behavior of the learner, maybe knowledge or attitude or maybe your skills. So that is the ultimate objective. So for that, what we will be putting in our medical education teaching learning process. So these are all the inputs and outputs that we will be. So what we need to make the student learn is the different competencies. So both subject divided into different competencies. Some thousands of competencies were made by NMC so that the students should be able to get through those. So that is the one input. So in each competency we can make a different learning objective for ourselves. And next is the teaching learning methods or materials. That may be by manpower or providing infrastructure or that may be a process. So these are the different methods of the inputs. And the student will be having his outputs. But how that output will be seen or it has to be seen. It's like assessments. It is nothing but previous exams and all. The exams are like our assessment. Different methods and models are there. May have at the end of the class or may have at the end of our courses or at the end of the year or whenever we want, all this can be done. So all these together to be aligned into our curriculum. That is nothing but the CBAP, which we are implementing it. Further, we are learning this BCME. Now let us see the domains of learning. As I said, these are the different dimensions that we will be learning. So on these three. First one is cognitive domain. Sir, can anyone raise hands who have already heard these terms? Yes, sir. Yes, sir. Acknowledge, sir. We consider there is a day. You think madam is good enough? Raise a hand. Yeah, okay. So what is cognitive? Now let's see. పదాలు పోతున్నాయి అందరికీ కానీ ఆర్డర్ ఉన్నట్టు cognitive nothing but acquisition of knowledge. How we get knowledge? We knowledge by reading or by simulation or going through different trainings or attending meetings, others. That is cognitive. Next is affective. What we will learn there are feelings, emotions, and attitudes. So the first one, cognitive, is associated with involvement of brain. Now, whatever the inputs we are getting, it has to be entered into the brain and it has to be processed. But like much of this affective domain has to be taken to it will also be pursued by brain, but it has to be taken to heart because the feelings or emotions or attitudes all concern heartfulness. Next is psychomotor. That is the acquisition of skills. So majority being clinical people, and you might be learning different skills how to learn, and now you will be making the students learn. Now, in each of these domains, and I said about this communication, this is also another domain where we are implementing it in the form of data. So psychomotor. The psychomotor is associated with next that is manipulation of transfer. That is motor movements. So the next is the domain of communication, which is much concerned with communication skills, communication abilities, and this is much more elaborately dealt in medical education for undergraduates in the form of implementing data modules. So throughout the course, right from the first year to final year, you have different modules. Now let us go to the different domains and their level of learning. In each domain, there are different levels of learning. Each range from lower order to higher order. Okay, we all get the knowledge, but where are we? At what level we are making the student learn? Now, we can go this one after the other. The first and foremost is cognitive, so the middle one. Okay. So here is the knowledge. Upon it is the comprehension, and upon it is the application, above it is analysis, above it is synthesis, and the last three evaluation. Okay. What is knowledge? If we say an example, can get it easily. Okay. So whatever the student reads from the book, just he makes that better into his brain. Like I want to take an example of some rheumatic fever. Okay. The student will take the book and open it, and he will read whatever that is there for diagnosis of rheumatic fever. Okay. Now what he knows the different signs of rheumatic fever. Okay. Until then, what he has got is knowledge. Now, is comprehension. That is ability to understand. So whatever that he has learned, that is like different criteria, major or minor or sexual or this. Now, in the next step, after knowing all these basic science or whatever that are present, now we will try to comprehend. That is the presence of either one major or two minor along with the essential criteria or something. So we make it a diagnosis of rheumatic fever. Now we will start to think. So previously at the knowledge, whatever that is there, we will try to enter into his brain and we will try to just remember it. Now we will try to understand. Okay, so these are there. Now I need to apply this. Okay, one from this is the criteria, two from this is the. Now we are able to comprehend, that is understand. The next is application. Now, the case has been given to him in the ward. So, you go through this case and apply your knowledge or your understanding whether this case belongs to rheumatic fever or not. Okay. Now, the student examines the case and he comes to know and already he has understanding of how many criteria has to be there. Now, he applies that and he will make sure that he has all the diagnostic criteria. If all these are there, yes sir, this is the case of rheumatic fever. If not, it's not. Okay. That is nothing but application. Having the knowledge and understanding, the next level is application. The next be analysis. So if at all we have put into a different new situation. Where the entire world got see how many rheumatic fever cases are there. We will go and each and every case, and we will be having new situations with each and every case. Definitely, it cannot be clear-cutly written. So this is present, this is not present. Now it starts even these applications skills also to analyze all this. That is higher order of thinking in this. That is analysis. And next is synthesis. Right. So majority while teaching for us, we will be starting either during assessment or while teaching. We at the undergraduate level, we will be trying to assess the students until this level. Analysis, undergraduate particular. So whenever we are going for postgraduate students or to the faculty, then we will go to the very order, like synthesis and even evaluation. The synthesis being, now we will be able to synthesize this whole material that whether whatever the criteria, those criteria whatever are being put, particularly ఉన్నాయా లేవా లేకపోతే దీనిలో మార్పులు చేస్తే బాగుంటుందా అనే వాటి. And next, evaluation. So, this is the final level of learning where now we will be an expert and whatever that has been written will straight off from this is all false and I can have my own and how to follow this. So, that is the level of evaluation. Okay. I said this with an example. Now, not only one, but all these cognitive domain. Whatever the student can learn, it can happen in these ways, and we can assess the student with this ability to make these works at different levels in this cognitive domain. Now, if you are able to read it out. So, at the basic level of knowledge acquisition. So, how can we test the student? This just define. Whatever in the book we will be able to define. No need of understanding, no need of thinking. Whatever it has understood, it's okay. But the basic level can be tested by having these words. Either define or identify, label the parts or something, or list out the causes or ideas or factors. So name the sign or symptom or recall or state. These are the very basic ones. See, if you have seen majority of our exams are being tested at this level. And if you have even the paper center also needs to be a little updated and needs to be applied. Student at least application style or physiology. And why we are sticking with this only? Always asking them to define or describe in detail something. That is one. And next is comprehension. That is understanding. Now, see the words here. So describe. That is in these four words, they have to describe what he has learned. Next is discuss, explain, locate, paraphrase, even in his own example, translate. So all these words is understanding. And next will be the application. At the level of application, now we can see. So apply this existing knowledge or carry out an activity or demonstrate. Demonstration is written to understand. Next, illustrate, prepare, solve, and use. And next is analysis. Now, given the situation, you will be able to analyze his understanding, his level of this. And you will be able to categorize the regular or a procedure in the fixed category forms, and be able to compare and contrast, differentiate, and outline. So these are the terms that will be used for testing the analysis level of cognitive learning. Next is the synthesis. The sample verbs being combined. So already his knowledge and his understanding and his level is learning. And now we will be able to combine two similar topics together, and we should be able to discuss it. And now we should be able to construct a different theme, different algorithm, design a program, or develop, generate, plan, propose. Now, with these verbs, you might have seen these verbs in our PG exams. Next, the last level be the final assess. Already the system is there. Now you need to assess that. That is right or wrong. Now, conclude, evaluate, other things, and interpret, justify, select, support. So these are all the verbs. Now, just have this in mind. At the end of this session, we do have an exercise where, based on these verbs, you will be able to categorize which domain it falls and should be able to identify the hierarchy or the level of understanding in the domain. Okay. So this corresponds to cognitive domain. And next is to go for affective domain. So here we can see receiving, responding, valuing, organizing, and characterizing. So as I said, the affective domain deals with feelings, emotions, and attitudes. So దాన్ని ఇంకా సింపుల్ గా చేస్తే ఏంటంటే 3 గా డివైడ్ చేయొచ్చు. సో ఏదైనా ఒక సందర్భం వచ్చినప్పుడు how to receive either bad or good. That is one. And after receiving, what will be if you are feeling sympathetically, we will try to console. Nothing but responding. And if that is our habit, whoever are in troubles or whoever are in difficult situations, let us not put them and let them be our general nature. So, రోజు చేస్తా ఉంటే అలవాటు అయిపోయింది. మనం దాన్ని చేస్తూ ఉంటే దాన్ని వాల్యూయింగ్ అయిపోతుంది. దానిపైన ఏంటంటే మన క్యారెక్టర్ అయిపోతే దాన్ని ఇంటర్నలైజేషన్. these are the different verbs that can be used in assessing the domain of learning at different hierarchy. So the basic one, receiving. So here what happens is selectively attends to stimuli. Whatever the stimuli, maybe suffering or maybe whatever, just hear it to us. That means the stimuli has reached whether the learner or the learner. That means okay. So this then we take an example of a person sitting outside an OD and attend the a patient which is going inside some operation and he is sitting outside. Now some tears are rolling down and intern just asking her what is this? Sees is crying. It is nothing but stimulus. That means now he is receiving at the receiving end further. And next is responding. So response to stimuli. So different verbs have been put here. I can take this as an example. Now, what is response is? We will be trying to console. Okay, danger in the other. That is respond. So the verbs, the sample verbs here as we mentioned here: accept, acknowledge, receive, accept, acknowledge, be aware, listen, notice, pay attention, tolerate. These are the examples. And for responding, so agree to, answer, feeling, assist, care for, communicate, comply, confirm, consent, contribute, cooperate, follow, obey, participate, be voluntarily, respond, volunteer. What is the responding? Okay, now it has responded. Next is value. Okay, if there is another respond. Next, other response is the next further. So it is some serious surgery is going on inside. You may lose the patient. Now, this intern is feeling from his heart that okay, this much is the problem. Now he has taken that stimulus into his heart. That is nothing but the giving value to his feeling. Like adopt the sample of being adopt, assume responsibility, behave according to, choose, commit, decide, exhibit loyalty, express, unity, prefer, see, show concern, show continually decide to use resources. So all these are called value. Next is organizing. It is the conceptualizes the value and resolves conflict between it and the other values. Okay, that is this problem of value. And now, what has to be responded is this. That is, as an intern, it does have okay, routine column or is it to console. Now, it's hard to decide something. So whether I need to spend time with him, console him, and spread that. And the other thing is he's having some conflict. So coming to a conclusion that okay, I need to address this first after value. So the sample must be adopt, adjust, arrange, balance, classify, conceptualize, formulate, group, organize, and clearance. So these are all the different verbs in organization of this affective level. And final one is the internalization. So if we are doing the same, we will take the image of a person like regularly, and that person even stimulates the others for this affective domain. So the example will be act upon, advocate, defend, exemplify, influence, justify, behavior, maintain, serve, support, and all these are the verbs that can be used for internalizing the affective domain. And next, the last domain is the psychomotor, which is associated with acquisition of skills. There are how many students have learned some surgical skills. So at least in our internship or some other period, we have learned the first surgery. Is that you might be experienced, you might have experienced all of these whatever levels. Now, first solution I am going to use the one. First solution, you can remember. Right away, say advice తీసుకున్నారు ఫస్ట్ knowledge. Next, skill, that is the implementation వచ్చింది. దానికి ఎట్లా స్టార్ట్ చేస్తారు? భయంగా స్టార్ట్ చేస్తారా లేకపోతే కాన్ఫిడెన్స్ కాన్ఫిడెన్స్? ఓకే. Okay, this psychomotor learning won't happen in a single day or a single time. This is also a process where we need guidance. Now we know. So psychomotor learning is demonstrated by physical skills like coordination. So you might have the skill, but first, but definitely it won't be at the level that you do have. What I mean. It's nothing but the first step you may not be having water. You have done it, but it takes half an hour. But the concepts and whatever the two concepts maybe one day that coordination is easier. Next, basic. Each time we need to what how to manipulate fingers, house. Next, manipulation. So how the hands has to be rotated or pushed out. The grace, strength, speed. All these are associated with the psychomotor skills. So now I want to explain this psychomotor skill with an example of hardware. So CMC sorry, I do remember that. So how many of you can drive a car? Just drive a car. That's it. Yeah. Okay, so majority can drive. So this is very acceptable. Women have learned car driving with the help of a driving school or maybe a guide. See besides. So what is all these skills? What is perception, set, guided response mechanism, complete road response, navigation response. So what is perception? ఒకటి ఏంటంటే డ్రైవింగ్ నేర్చుకోవాలని అనుకోవడమే ఫస్ట్ పర్సీవ్ డ్రైవింగ్ నేర్చుకోవాలి. దట్ ఈస్ సెన్సెస్ క్యూస్ దట్ గైడ్ వాట్ ఆర్ యాక్టివిటీ. సో నేర్చుకోవాలని అనిపించడానికి కారణం ఉంటే నేర్చుకోవాలని అనిపించగలే ఫస్ట్ పర్సెప్షన్. నెక్స్ట్ ఈస్ సెట్. ఓకే నేర్చుకోవాలనుకుంటున్నాను బట్ హౌ? మనం సీట్లో కూర్చుంటే నేర్చుకోవాలి. దట్ ఈస్ సిట్ ఇన్ ద డ్రైవింగ్ సీట్. అక్కడ ఎక్కడ కూర్చున్న ఎమోషన్ వేరే, డ్రైవింగ్ సీట్ లో కూర్చోగానే ఫస్ట్ టైం అక్కడ ఎమోషన్ సెట్ ఈస్ సెట్టింగ్ అవర్ బ్రెయిన్ మెంటల్లీ, ఎమోషనల్లీ, ఫిజికల్లీ రెడీనెస్ టు స్టార్ట్ ద ప్రాసెస్. నెక్స్ట్ ఈస్ గైడెడ్ రెస్పాన్స్. సరే కూర్చున్నాం, డ్రైవింగ్ సీట్ లో కూర్చున్నాం. నెక్స్ట్ ఏమంటాడు? ఓకేనా, గైడ్ కూర్చోండి. గైడ్ కూర్చొని ఏం చెప్తాడు? చాలా సింపుల్, ఏం లేదు నెక్స్ట్ అది డ్రైవింగ్ స్కూల్ వాళ్ళు కాకుండా బ్రదర్ సిస్టర్ కానీ ఇట్లా కూర్చోబెట్టింటే అది ఏం లేదు క్లచ్ గేర్ వెయ్యి క్లచ్ సైకిల్ ప్రెస్ పోతా ఉంటుంది. ఓకే సరే అని స్టార్ట్ చేస్తాం. ఏం చేస్తాం? క్లచ్ వద్దాం, ఫస్ట్ గేర్ వేస్తాం, క్లచ్ వద్ద యాక్సిడెంట్ చేస్తాం. ఏమైంది? ఇది ఫస్ట్ ఎక్స్పీరియన్స్ అందరికీ జరిగింది. ఓకే నెక్స్ట్ గైడ్ ఏం చేస్తాడు? వాట్ ఎవర్ ద మిస్టేక్ దట్ వి డిడ్ వి ట్రై కరెక్ట్ ఇట్. ఆ కార్ లో క్లచ్ వదలాల్సింది స్లోగా రిలీజ్ పాయింట్ ని చూసుకొని ఆ రిలీజ్ పాయింట్ ని రిలీజ్ చేసుకుంటే యాక్సిడెంట్ చెప్పేస్తాం. నౌ ఇట్స్ నాట్ ద సెకండ్ టైం వి డు ఇట్ ఎవ్రీథింగ్ బెటర్, బట్ అయినా కూడా అవుతుంది, బట్ కొంచెం బెటర్. అది గైడెడ్ రెస్పాన్స్. నెక్స్ట్ దిస్ మెకానిజం what performs the same act with increased efficiency and confidence. So a guided response story ఒక వారం రోజులు పోయినా వారం రోజుల తర్వాత స్టార్ట్ చేసి రన్ చేయమంటే అది లైక్ ఈవెన్ అప్డేషన్ ఉంది, మార్చుతున్నారు, పేరు మార్చుతున్నారు, కంటెంట్ చేస్తున్నారు. Definitely the skill set has increased, increasing the clutch and moving away. And next is complete home response. Now, guided also everything. Confidence is given after that. Autonomous driving. So, by what one will be. So, internal driving I am very skilled and confidence in it. Okay. Next is adaptation. Okay, our skill is driving skill. Regular about next, in this adaptation, he needs to adapt his skill sets to meet a problem situation. ఎట్లాంటిదంటే సరే డ్రైవింగ్ నేర్చుకున్నారు కదా ఇప్పుడు పోదాం పోయిన తర్వాత ఏంటంటే హైట్గా ఒక రైల్వే ట్రాక్ ఉంటుంది సో గేట్ వేసుకున్నాం కార్ మామూలుగా వెహికల్ అంతా వెహికల్ పెట్టుకుంటా వస్తుంది అదంతా ఫేస్ సిచ్యువేషన్ ఎట్లా ఉంది కొంచెం స్టాండ్గా ఉంది ఆటో రోడ్ వచ్చేసి నాలుగు పెట్టాడు ఓకే నెక్స్ట్ ఫ్లెక్సిబుల్ తీసుకుంటే బ్రేక్ ఉంది క్లచ్ ఉంది కానీ నాలుగు రెండే ఉన్నాయి మూడో లేదు బ్రేక్ పట్టుకుని తీసుకుందాం ఐడియా ఆ టైంలో పార్ట్ ఆఫ్ థింకింగ్ ఈ సిచ్యువేషన్ ఎట్లా ఫేస్ చేయాలా పోనీ బ్రేక్ వదిలేసి యాక్సిడెంట్ ప్రెస్ చేద్దామా వెనక్కి ఇవ్వబోతే ఆటో అవుతుంది లేదా యాక్సిడెంట్ మంచిగా ప్రెస్ అయితే వదిలేస్తాం అలాంటప్పుడు ఏంటంటే thought of and he started applying his brake. Okay, our handbrake lo undi kada. Our three government handbrake orders. Handbrake is all the brake and all this is. Now he started utilizing this hand. So what he did is he tried to adapt to a new situation. That is adaptation. Next is organization. So ఇట్లాంటి స్కిల్ చేసి ఇట్లాంటి అంతా వచ్చేసిందంటే రైట్ ఇతను ఏంటంటే డ్రైవ్ స్కూల్ పోవడం లాగా మీతో ట్రైన్ చేసేది now he will be able to run his own skills at all levels even to international level. There is nothing but the organization. So the levels of hierarchy of learning the psychomotor skills is perception, self guided response, mechanism, complete load response, adaptation, and organization. I think this for example, I think you might be knowing. So, is skill, manipulative skill, will be somewhere at one of these, either the adaptation or at the level of organization. And the same positive skill sets here that Indian scientist and చాలా సింపుల్గా ఇచ్చిన టెర్మినాలజీ. సో ఫస్ట్ వాట్ వి ట్రై టు డూ ఇస్ చూసి ఇమిటేట్ చేస్తాం, తర్వాత మనం చేయడానికి ట్రై చేస్తాం. దట్ ఇస్ మ్యానిపులేషన్. మరి రోజు చేస్తాం వల్ల ఏమొస్తుంది? ప్రెసిషన్ అండ్ డూయింగ్ ద థింగ్ వస్తుంది. దాని తర్వాత ఆర్టికులేషన్, డిఫరెంట్ థింగ్స్ టు బి డన్ సైమల్టేనియస్లీ, దట్ ఇస్ కాల్డ్ ఆర్టికులేషన్. అది రోజు చేస్తాం అంటే వచ్చేది న్యాచురలైజేషన్. అంటే డ్రైవ్ చేయమన్నప్పుడు ఆలోచన లేకుండా కూర్చోవడం ఇట్లా naturalization without so these are the different levels of domains of learning. So as we said, we do have an exercise at page number 66 where we do have 15 examples given. Page number 66. Each domain given topic belongs to. Individually read each one of you, read and pick out later. And along with that, I was thinking over which level of learning that belongs to. I think the 2 minutes time is sufficient for that. So we are here to make mistakes. So one of the principles of adult learning is to make the environment comfortable. Okay? There is no embarrassment, nothing, whatever that the mistake or I do. Colleges. I hope everyone has finished. Yes. So let's have a brief discussion about it. So the participants will be reading their own giving the answer to the discussion and meeting. So from the first group, the participant can read out the first one. Getting out the knowledge at the end of the lecture, the individual will be able to clear the answer.
I use this topic. And they will be the mic to use this topic.
This will be one of the cognitive. Very good. Appreciation. Appreciation by that's after it's right. Okay, sir, good. But at what level, sir? So, on the screen has been mentioned, so the cognitive domain, so knowledge to evaluation. What levels? Basic level, that is knowledge level. One participant, everyone, sir.
At the end of the applied learning tutorial, immediate student will be able to select an appropriate institution for training in efficacious actions.
Sir, yes, cognitive. So can you comment which level of cognitive domain can be?
Application.
Yes. So it does have knowledge and understanding of these different institutions. Now you apply which to solve. Okay. Next. Third. Sorry. Yes, sir. Third. So it's a skill based. So the domain is psychomotor. At which level, sir? Adaptation. Sir. Let me see. Here, this is a demonstration session. The MBBS student. There can't be a single one. Either it can be mechanism, it can be complete over resistance. Okay? Good, sir. Next one. We are right.
At the end of the clinical discussion, the immediate student will be able to comfort the patient who has had an injury.
So the domain is affective domain. Okay? Because the student is able to comfort a patient who has acute injury. At what level, madam? Is able to comfort. No, responding is trying to communicate, but it is able to comfort him. So it goes to a little higher. Yes. The value or it can even be organization.
The students in our community student will be able to make instruction for an acceleration of branching of
Which domain? Sir, psychomotor domain. I need it to be cognitive domain because the writing description is not a skill, but for writing it, knowledge and its application for a case of bronchial exacerbation. The applied is knowledge. So again, it belongs to cognitive domain. Your explanation?
Student has to discuss the treatment patient who has to apply his cognitive and cognitive he has to patient
Because the additional insights also like this. Cognitive domain, but higher thinking. Next, last sixth question. What's your faster better?
At the end of a small group session with role play, the MBBS student will come to class on most days. I think it is cognitive, sir. It is training the brain.
What has been done is the student will be able to come to class on most days. That is changing the students' attitude. So it is concerning attitude. So that is affective domain. Again, the first group are 7. Cognitive domain. He has the knowledge of a whole area and he will be able to get into the parts.
Applying what we learn.
Very good, sir. The application of knowledge is not a skill. Psychomotor means add information and also. Listening also. Skill set అంటే మీరు అనుకునే ఏంటంటే థింకింగ్ ఆల్సో చేస్తున్నారు. థింకింగ్ sir, writing, drawing excellently, maybe a general skill. Not constantly టాపిక్ సంబంధించిన స్కిల్ అయితే కాదు. అసెస్ స్టూడెంట్ నాలెడ్జ్ తర్వాత ఏ లెవెల్లో ఉన్నాడు
Just to reiterate what sir is saying, if you have a student, you are asking them to draw, say, an angle or something with all the parts marked. Are you going to give more marks to somebody who draws very beautifully, or are you going to give marks to somebody who draws a line diagram but labels everything correct? That is what this question is supposed to make you understand. It doesn't matter if they can draw beautifully, they are, Van Gogh, whatever does not matter. But do they have the knowledge? Therefore, since it's a knowledge-based area, the domain becomes cognitive. So, sir,
thank you, sir, for your good explanation. The second thing, appropriate decision for any subject is not incisive method. It's just selecting an incision. Okay, next. Cognitive skill because see ఎక్కడైనా కౌన్సిలింగ్ ఉంది కాబట్టి అంటే కమ్యూనికేషన్ డొమైన్ లేకపోతే అఫెక్టివ్ డొమైన్ లాగా అనిపిస్తుంది కానీ the work that they have used is the students will be able to rank కౌన్సిలింగ్ జరుగుతా ఉంది what the student is doing is observing how the counseling was he is just ranking based on knowledge this is cognitive domain. This is the next subheading. Yes. Yes. Explain the procedure of different kind of yes. Explain the procedure. Next. Psychomotor, because he is demonstrating the skill of using a spacer. Next. Meeting.
Demonstration that will be able to concentrate the right hand.
Yes, cognitive but higher order thinking. Yes, next.
Orientation program, the intern will be able to ensure responsibility to all patients admitted under him in any given proceeding.
Yes, madam. Yes, we got again the affected domains. Because taking assuming the responsibility. Sir, next. Okay. Psychomotor skill. Yes, sir. You opportunity to those who which domain, sir? Cognitive domain. Because he's not doing the CPR. He is just enumerating the steps in the CPR. So now I think we have got the understanding of different levels of domains. What is cognitive, affective, and psychomotor? Next. In this session, we also learn about the principles of order learning. So, what are the differences between adult and child learning? ఎవరైనా మాట్లాడచ్చు ఏం తేడా ఎస్ ఎనీవన్ డిస్కషన్ కదా adult has already some so he is mature enough and he is willing to take information. Yeah. Discussion, sir. Same of time. So, how many of us community medicine either in PG pedagogy is separate on time working చేస్తుంది డిపార్ట్మెంట్స్ లో పని చేస్తలేదు pedagogy is nothing but the art of teaching whom children actually but who will be who will be educating totally it is adolescents and adults. The organizations suppose both candidates, whether adolescents or adults. With the same principles of pedagogy will apply to adolescents and adults. Or how are they different? తెలిస్తే మనం ఏంటంటే మనం చెప్పే క్లాస్ రూమ్లో ఎందుకు మార్పులు చేసుకోవాలని తెలుసు కాకపోతే ఏంటంటే వీళ్ళు పెట్టిన పదాల్లో మాత్రమే మనకు తెలియదు ఏది కొత్తగా నేర్చుకున్నాం అనుకోదు అది తెలుసు ఒక పద్ధతి ప్రకారం పెడితే కాగ్నిటివ్ అఫెక్టివ్ సైకోమోటర్ చెప్తున్నాం. పిల్లలు ఎట్లా అంటే వాళ్ళు ఏం నేర్చుకోమంటే అది నేర్చుకుంటారు. స్కూల్లో ఏ పంపంటే ఏ అని పంపుతారు, ఎందుకు పంపారు ఏం అడగారు. బట్ అడల్ట్స్ ఏం చేస్తారు, అది ఏ అని ఎందుకు పంపారు ఇస్తారు అడిగినట్టు ఎందుకు అని అంటారు. But deep learning content is important because adults program is. And then first year are also very important for when he starts applying or he does face the need of application of this. Then in educational setting, school class పిల్లలందరూ ఒకేలా ఉంటారు, ఒకే ఏజ్ ఉంటారు, ఆల్మోస్ట్ ఆఫ్ ద సిమిలర్ బ్యాక్గ్రౌండ్ ఆర్ ఏజ్ కానీ వాళ్ళ నాలెడ్జ్ కానీ అంతే ఉంటుంది. బట్ ఈ క్లాస్ రూమ్ లో మన వాళ్ళు ఎలా ఉంటుంది, డిఫరెంట్ డిపార్ట్మెంట్ ఆఫ్ డిఫరెంట్ సీనియారిటీ, డిఫరెంట్ నాలెడ్జ్. సో that makes the adult learning a little different. And readiness to learn even with development. Development అంటే పెద్దయిన తర్వాత అవసరం అవుతుందని చెప్తాను. కానీ అన్లైక్ అడల్ట్స్ ఏంటంటే నాకు నీడ్ ఉంటేనే నేను తెలుసుకోవడానికి ప్రయత్నం చేస్తాను. ఇది మ్యాండేటరీ చేయకుండా అనుకోని చూసినాను బీసీకి కదా, మనకు తెలిసినదే. కాకపోతే ఏంటంటే సర్టన్ థింగ్స్ టు బి entered into system by rules or regulations. But after which we will be inculcating it in the next phase. ఏదైనా అంతే సార్, స్టార్టింగ్ అంటారు రీసెర్చ్ మెథడాలజీ అప్లికేషన్స్ మ్యాండేటరీ ఇన్కల్కేట్ అలవాటు అయిన తర్వాత ఏంటంటే become a habit of us. So similarly teaching learn because it will be of use in future. Adults ఏంటంటే నాకు అవసరం అవుతుందంటే నేర్చుకోవాలి, ఎక్కువ అవసరం అవుతుందా. So many of the times the children are extremely motivated for the sake of grading, rank, prize, and what. And adult learning mostly the form of self-esteem. Okay? So actually, I'm putting research methodology. And నేర్చుకోవాలి internal desire to make it a post-pure or knowledge. So now let us see the principles of adult learning. So these are the 8 principles of adult learning. But when can an adult learning can happen? One is safe, non-threatening environment. Okay. పిల్లలకైతే క్లాస్ రూమ్ లో కూర్చొని టీచర్ అంటే భయం ఉంటుంది, మాట్లాడుకుంటూ కూర్చోబెట్టాలి, రూల్స్ రెగ్యులేషన్స్ ఇస్తాం. కానీ అడల్ట్ లెర్నింగ్ అలా కాదు. నాట్ టు బి rigidly framed in rules and regulations and threatening behavior. It will be like this, open behavior. Okay, మాట్లాడాలి. So no one is going to harm you or humiliating or nothing will be done. So definitely it is a safe learning environment. So in that environment only person can next is learner being an active contributor. ఇక్కడ టీచర్ నేర్పించేదే కాదు, స్టూడెంట్ నుంచి కూడా టీచర్ నేర్చుకునేది. Not in the sense of knowledge, but in different aspects. They can also contribute to us how a teacher has to be. By the way of feedback, suppose if student gives us feedback that in this way it could have been a better class. If I can't come to feedback, we will learn it and I will implement in the next class. Next is build on existing knowledge. Second year student question ranges already academic which are the basics. You may be knowing. Now, whatever that our teaching has to be built up upon those. Not again teaching the same or our knowledge in the existing knowledge to peట్టుకొని kind of. Next is the relevant content. Content relevant like of course, ఉన్న జనరేషన్ పిల్లలు అయితే relevant చెప్పండి, ఏమన్నా చెప్పండి, I can grab the attention of the maximum 50%. The other 50% will be very tough. Alaantappudu we may how to improve our content to make even them also safe. And next is participate. అందుకే అదని మాట్లాడాలి. పార్టిసిపేట్ చేస్తే డిస్కషన్ వస్తే డిఫరెంట్ డౌట్స్ వస్తాయి. అనుకున్న డౌట్ ఎక్స్ప్రెస్ చేశారు. చాలా మంది డౌట్ ఉన్నప్పుడు ఎక్స్ప్రెస్ చేయని భాష. They will also get benefit. Next, problem centered approach. Adults అంటే ఈ ప్రాబ్లమ్ సాల్వ్ చేయడానికి how this class or how this teaching will be useful to us. అనేది ఆలోచిస్తారు. There is not my problems or my system of approach. Next is support for self-directed learning. So adult learning most of the time will be happening from self-directed learning. You know, most times we see formal కూర్చోబెట్టి ఎన్ని క్లాసులు ఎంత సబ్జెక్ట్ చదువుతాం. Very less. Even self-motivated and self-directed. So for that, what a teacher has to be, they have to be a facilitator. Okay? And they sometimes do so to do money, but so much into the company. Okay. What based on the student, or based on the student's behavior, we need to give them opportunity for this whole goals. Okay. Either the time based learning, like the age నేర్చుకోవడం కానీ స్పీడ్ నేర్చుకోవడం కానీ లేకపోతే అసెస్మెంట్ అన్ని మార్కులు తీసుకోవాలి. ఇవన్నీ ఎట్లా అంటే వాటికి మనంగా డిసైడ్ చేసేది. ఈ హ్యాస్ టు రియలైజ్ ఈ హ్యాస్ టు డూ దిస్ గోల్ దట్ ఇస్ బట్ ద సెల్ఫ్ డైరెక్టెడ్ లెర్నింగ్. For that, we teacher being the facilitator, not teacher. And next is constructive feedback. So whatever the teacher learning process that is going on has to be always improved by way of getting feedback to us. So these are the adult learning principles. What is the learning has to be non-threatening environment, and the learner being an active contributor, and has to be built on existing knowledge. The content needs to be relevant. It has to be participatory. Problem-centered approach has to be taken up. An opportunity for self-directed learning has to be given. Then, good constructive feedback. Feedback ఏమంటే రాసమనే చాలా రాసిస్తారు. అప్పుడు ఏంటంటే constructive అన్నమాట. ఎట్లా అంటే అసెంబ్లీలో కూర్చున్నట్టు ప్రతిపక్షం ఎక్కువ చేసేది నిర్మాణాత్మకమైన ప్రతిపక్షం అంటారు. దాని నిజానికి ఆ నిర్మాణాత్మక వాడదు. So these are the adult learning principles. So whatever that we have to do. Products learn best is the conditions when the learning can be effective. So they feel valued and respected. They don't be learning to be best. The learning experience has to be active. Their participation, not that passive just introduction of matter. The learning experience has to fulfill their needs. They accept the responsibility for their learning. This is the their learning has to be actually the responsibility for their learning. So the responsibility has to be taken up by them. As teacher, we will be motivating them. We will try to make them so we will be mentoring them to the lives. But ultimately, the learner has to take up the responsibility. So the learning is best when the learner addresses ideas, feelings, by these conditions, the learning can be best. Whenever the new material is created, what they do. So, the training environment is conducive to learning, and learning is reinforced. Learning principles which vendors are money suggestion. certain things has to be reinforced, not repeated, so that it will be learning effective. Learning is applied immediately. Learning occurs in best in small groups. ఇదే మనకి ఏంటంటే ఎంసీఏ ఏంటంటే కూడా ప్రీవియస్ ఏంటంటే ఇంకా కోర్సెస్ లేకపోతే ఇంకా థియరీ క్లాసెస్ ఉంటాయి. Why they have made it mandatory that almost 50% of the classes, more than 50% or 60% has to be non-theoretical. So that's why they want to make much of the learning to be based on SGDs, very small group discussions. So the learning there is will be interactive and it will be much more effective. So whether the trainer values their contributions. These are the conditions. But learners can learn this. The other is famous proverb. So I see, I hear, I forget, I see, I remember, I do, I know. If I hear, I could have been able to do this. Then I'm choosing exercise. Then I'm just now. That's there. So, in order to get maximum attendance, what we need to do is we need to hear, we need to say, we need to see and do. Whatever the practically whatever the we are doing, things that will be best. Next, we will have a group activity where each group will be having a small teaching session. We plan a teaching session. So one being a teacher, other being learners, following the principles of adult learning. So these are the principles of adult learning. Try to follow as maximum as, and each group try to make your work a simple teaching topic. So just within a time frame of 5 minutes. So in 5 minutes, you prepare yourself a topic where you should be able to discuss the principles that can be followed. So one of the group can be teacher, faculty, the learners. After group activity, decide yourself who is the teacher first. Within a time of 5 minutes, you need to evaluate.
homocysteine antimetabolic in the vitamins vascular causes vitamins and for B for B for I for T for T for Q
After this session, one link is given to your cell phones. One link has been kept. Please, after this.
సార్ ఒకటి లింక్ షేర్ చేస్తుంటారు బిగ్గెస్ట్ క్వశ్చన్ అది అందరూ ఏంటంటే సెషన్ అయిన తర్వాత actually it has to be happened at the start only.
So during
Whatever we are up to now, okay, we will discuss the same. Okay, in each team. Greatest question I will have a discussion here. Greatest question I have is later after discussion of this, I will be given to you for answer. Please, concentrate here. Sir, whom you are students So, being expressive for the postgraduates. So, unless you have postgraduates, the teacher wants to discuss about the foreign body education. In their participation, because you are asking them to read out the X-ray and come with the answer. It is a problem because for taking case like this, you are discussing. Not an emergency, to give them time to prepare for this.
Say loudly, say whatever you are saying, say loudly.
So, we can get the feedback from them. How much have you learned with this? Okay? With this knowledge, so that you will be able to on your work. Yes. So, you can appreciate the team. Okay, sorry. Yourself, info, సార్ అవగాహన కాబట్టి ప్రోగ్రామ్ ఇస్తున్నారు. ఓకే సార్. So what are you are going to do, sir? Okay, so you want to address the doctors community. Because the request has come from the participants to elaborate the TV program of TV control. So already they do have the knowledge regarding RMC program. Yes. Okay, now, okay, you want to add on the recent changes. Yes. How can you make this growth? How can you make this participate? Okay, so it is right now discussion. It is a small group discussion. The learners will be discussing. Okay, these are the past now change. Okay, you get the feedback from this. What feedback you have teacher? What is learning process? Just appreciate for input. Not participating. Yes, okay, we nominated this. Rama is so the same nominated, how can we make it? Right, manage this problem. Problem centered approach. the problem that the postgraduates will be getting regularly. So they will be exposed to medicine chronic cases. Definitely that is a problem that the doctor will be getting. So said that how can this decision be made more effective? So again, sir, we look at our except what we do, we get that explain just to then it becomes a perspective. Thank you, sir. Appreciation for the team. Next, before our 5, 2, who is your learner group, sir? So these are common characteristic of the group. ఏంటి అంటే ఎవరిని ఎక్స్పెక్ట్ చేస్తున్నాడు సైలెంట్ గ్రూప్ టీచర్సా లేకపోతే స్టూడెంట్సా ఇంటర్న్స్ ఓకే ఫస్ట్ ఎగ్జిస్టింగ్ నాలెడ్జ్ ఓకే ఎగ్జిస్టింగ్ నాలెడ్జ్ ఎంత ఉందనేది ఫస్ట్ మాట్లాడుకుంటున్నాం ఎస్
So there were like from different knowledge background.
Yes.
Trying to fill the gaps.
So first stick on to these 8 principles. ఈ 8 principles ని ఈ గ్రూప్ ని ఎడ్యుకేట్ చేసేటప్పుడు ఎలా ఇన్వాల్వ్ చేస్తాము? So how can you make the same group to be participatory in your stroke learning?
So any knowledge gaps.
Yes. Just before commencement of this session, you may have asked these people to be ready with some pathology or someone on etiology like that. So they will be discussing their own strategies or their own knowledge. So let's make them participate. Problem centered approach.
How to manage other science.
Okay. Now, based on the case they do, they had a bad experience. Now they want to update on this. Is the content relevant? Definitely. As a notice, already one has relevant content.
Existing knowledge, we ask some questions to the we build our knowledge on the existing.
Is this learning happening in safe and non-threatening environment? Yes. So that's how. So follow the principles. The same whenever we apply this to either undergraduates or postgraduates or interns, we need to make sure that all the principles to be followed. Yes, appreciation please. Yes. Okay. Okay. Okay, how they play the learning is they want to teach the group of postgraduate students regarding the antihypertensive drugs. Okay, so for that, how the students they made the students participate is each student has been assigned one class of drugs to get prepared and come. Okay, that made them participatory. Yes, sir, next.
Then Madam gave us a clinical scenario.
Yes.
Based on a clinical scenario, based on the clinical scenario, she asked the group what type of drug is being used in this scenario. So the learner starts answering. So based on the responses, Madam corrects them. So this is what you have to do. This is what. So and she supports for the entire thing learning. So at the end of the session, she gave us how to improve our skills further and in a constructive way.
Yes, sir. Good way. Something is that learning has happened while the student has prepared and ready to have the anti-hypertensive drugs to be learned. Next, the problem-centered approach. Read the case scenario. So they have been given a problem and to take action on it. And delay participation, the content being very relevant and building on existing knowledge.
Already postgraduate,
That is an active contributor, and the environment has to be safe so that we can make progress. So thank you. Give an applause for this. Coming to the last group. Performing CPR. So other category, who are the learners here, sir? Enters to group. Not a winner. Yes. Definitely, this is problem centered because mentors are working in casualty. Problem centered. Because they will be very one or two cases, maybe see unconscious, or they need to CPR. Okay, they do have the background knowledge already and being leaders. Yes, sir? Yes, definitely the content is relevant in their invention. Yes, you make them participatory by involving them in these activities. Sir, is it a non-threatening environment, making them run casually and then with an unconscious patient? So you want to make them learn on an silent mannequin, or you want to make them learn on a patient? So you want to make them learn as a group, quite a mannequin. Okay. What kind of it? So that gives them same as non-threatening environment because they do have their own apprehension. What happens to this case if I do the CPR? Is somewhere or is it? But how do you get the feedback from the interns regarding their learning? So what they have learned, let's share this. Freedom is taken ఏంటంటే సార్ మేము నేర్చుకున్నాం ఉపయోగపడతా లేదా అనేది అట్లీస్ట్ చెప్పగలం వాళ్ళు నేర్పిస్తారంటే సార్ మేము ఏంటంటే ఇది చేయడానికి రెడీ సిపిఆర్ చేయడానికి బట్ ఏంటంటే అయినా నార్మల్ బ్రీదింగ్ లేదంటే should applause for this. So that's how we need to integrate these principles of adult learning to our regular lives. That may be either from first MBBS to our postgraduates, or even our learning can be even our fellow colleagues also sometimes. So that concludes our learning domains and the principles. So thank you for participating and listening to me patiently.
Thank you so much, sir, for enlightening about the principles of adult learning and also about the domains of learning. And the activities are so much active, and every group has participated very well. So previously in the first session it was little low, but it has come on to the pace, and everybody is actively involved. Even after doing activity also, before sir is telling, you are giving appreciation by giving claps. So that is your active participation. So we have also well versed about the domains of learning, the cognitive, psychomotor, and affective domain. So can frame your planning schedules in your teaching modalities. Thank you so much, sir. Now I get
Please gather for the snacks and tea over there in the next room. For 10 minutes, sir. And then you can come back and do the quizzes. Time to time schedule will be done. We will select candidates when you come back over here. 10 minutes only, please take your snacks and tea and come back. And we fill up the link.
Hello. Hello.
ఉందా సార్ రిసీవర్ ఉందా రిసీవర్ ఉంటే పని చేస్తాం
హలో వినిపిస్తుంది ఇప్పుడు
హలో హలో హలో
ఆడ స్పైక్ లేదు సార్ పవర్ సప్లై
దాన్ని సైన్ చేసేటప్పుడు చెక్ చేసుకోండి దాన్ని డీటెయిల్స్ చేసి సైన్ పెట్టండి దాన్ని మీకే చెప్తున్నాను మీ మళ్ళీ వచ్చినప్పుడు అనౌన్స్ చేస్తాను మళ్ళీ అనౌన్స్ చేస్తాను చేస్తే అలా సైన్
అనౌన్స్ చేసి మళ్ళీ ఒకసారి
చేస్తాను Sir, please fill up the link which we have provided in your WhatsApp group first. Link or contact the group. అది రిక్వెస్ట్ చేయండి సార్ అదే మీరు తెలియకుండా పెట్టండి
క్లాస్లో తెలియాలి
I request one of you to be rapporteur of this today's session. ఎవరన్నా మార్నింగ్ నుంచి అయింది ఎట్లయినా జరుగుతుంది ఈవినింగ్ వాలంటరీ Today anyone voluntarily can come out to be a rapporteur, sir. ఏం జరిగింది ఏం నేర్చుకున్నారు మీ మాటల్లో చెప్తే చాలు సార్ చెప్పండి సార్ Session is starting. Please, participants submit to the hall. Ask them request. Sir, once again I will tell you when the form for signing is coming to you. Check your members, phone name, along with initials. It should be according to your MBBS certificate, the spelling, and then your phone number, email ID, and NMC ID. Don't just sign without seeing anything blindly. When we are circulating the papers, we just see them and sign them. Okay? For attendance also, we'll send one paper. Sir, anyone willing to be rapporteur for this today's session? Morning, afternoon. If it is not by your choice, we will take our chance. Okay? Dr. Sumati. For tomorrow, sir? Tomorrow? Day 1, 2, day 1, 2, day 2, day 3. 3 rapporteurs. Day 2, morning change జరిగిందో you will be of that chapter. please come silently. Okay, then we will talk about date tomorrow. Today, next session will start by Dr. Yadvendra Reddy, sir.
Okay, good afternoon. The topic given to me is very easy. So let us start the topic. What is the meaning of ING? Master, what is the meaning of ING? Question? Huh?
Indian Medical Graduates.
So, okay. So the topic for the session is goals, roles, and competencies and learning objectives. So earlier there were some regulations were formed during 2012 regarding medical education, but they were not sufficient. So MNC introduced this CPM curriculum. Earlier it was MCI, now the word is MNC 2019. So what is the difference? Why it has been introduced? The earlier traditional method was, it is a time based and also it is a group learning and assessment was summative and it is faculty based. Now the what is the change was made, now it is learner centered and it is individualized and both it is the assessment is summative and formative and self-paced. The earlier problem with the earlier teaching was it is didactic lecture. That is a one-way traffic. The teacher is giving a lecture. Some students will be learning. Some will be hearing. You know the difference between hearing and learning. So some will be learning. Some will be listening. Some will be hearing. Some will be doing crosswords or nowadays they have a mobile phone. So only some students are learning, and this is like a just You are giving a lecture, you were just giving a lecture, you don't know whether they learned or they didn't. So the change has been necessary. So the MNC introduced this competency-based learning. So earlier was it is a faculty-based, now it is student-centered. So the demands of the previous curriculum was after the completion of a year or after completion of final year, you will be a not a clinician, and he achieves high marks but fails to serve the need of the community. So all these changes were brought into the system. Just achieving the marks is not fulfilling the need of the community. So the changes has been brought. So just this cartoon will tell us why the change has been necessary. One of the puppy owner taken the puppy to the puppy trainer and asked him to teach his puppy how to whistle. He brought out the puppy and watched it for a month, but the puppy is not able to whistle. Then he again taken back this puppy to the trainer and asked him, what you have teach? Then the trainer asked him, teach that, but I didn't say is the puppy learned it. So we are just teaching is not enough. We should know whether the student learned it or not. That is the meaning of the CPM curriculum. So competency-based learning is it includes designing and implementing medical education curriculum that focuses on desired and observable ability in real life situation. What is necessary in real life that should be learned by the student. That's why this competency-based is designed so it is necessary for design like that, and it has to be implemented like that, and the focus should be ability to learn the which can be applicable to the real life situation. What is competency? What is competence? What is competent? Suniti? Suryan? So all are similar words, but the difference is competency is an activity just which can be observed. Competence means having the knowledge of that activity. Competent means if you have a required skill to perform it. Competency is an activity. Competency is having the knowledge of activity. Competent means you should be able to perform that activity. So MCI, now the term is MNC, it has to all these, to implement this UDME, we found some goal. The goal of the MCI is to create an Indian medical graduate possessing requires knowledge, skills, attitude, and also attitude. That's why we introduced attitude module and values, responsiveness, so the main goal of is create a Indian medical graduate to possess requires not only sufficient knowledge, skills, and also attitude, and also the MNC wants to have values and ethics and responsive to the society, so that ER may function as a appropriately and directly as a creation of first contact of the community. And also, it should be related to the global, what is happening internationally. So, you should possess all the required knowledge, skills, and should have a good attitude, and you should have values, and should be responsive to the society, and he should be the first contact person of the community, and he should have a relevant global knowledge. So, at the end, you should be a great environment where God is the first contact person of the community. To achieve these goals, you should have some roles. What are the roles? Earlier there were 5 roles, now they are extended to 7 roles. So on the report, if you are having, write down what are the expected roles that this IMG should play. 2 minutes. Goal is make a IMG as a first contact person of the community. But what are the roles he has to play? NMC has advised 5 roles, now they are 10 to 7 roles. What are those roles? What is the first role? What is the first role of the IMG? That usually all of us know it. So he is a clinician. What's the next role? So this is all the problem that BCME has introduced. So one way traffic is not. The answer should come from the students. They should be actively involved in learning. The forcefully we have to involve them in learning. So he is a clinician and he should be a leader. He should be a good communicator. That is very much necessary in present scenario. And you should have lifelong learner. You should and you should get update himself. And you should be thorough professional. Stick to the professional. So to achieve the goals, you should have these roles: clinician, leader, communicator, lifelong learner, and professional. So in order to fulfill these roles, the Indian medical should have obtained the following set of competencies. So to achieve the goal, he has to play roles. To play those roles, we should develop some competencies. Each one role has some competencies. So clinician, who is the clinician? As per the NMC, who understands and provides. These eye-sounding words will be there, but we have to go through it. We understand, provides preventive, promoting, curative, and palliative, and holistic care to the patient. So it has further you should have these competencies. So you should demonstrate knowledge of normal human structure, and you should demonstrate knowledge of abnormal human structure. Clinicians should have these competencies about, and you should have some knowledge of medical legals, ethical and humanitarian principles, and you should have a knowledge of all the national and regional health policies. And you should be able to identify the disease, and you should be able to take the history in concerns to the gender, age, and situation. You should be able to identify the disease, and also you should be able to examine in relation to the gender and social economic status. And you should be able to problem solving, and should be accurate, clear and appropriate. You should be able to maintain the records, and you should be able to record all the events, and you will be able to choose the appropriate diagnostic tests and prescribe and administer appropriate therapies, like disease prevention, health promotion and care, pain and distress alleviation, rehabilitation and palliation. And these are other competencies he has acquired. So as a clinician, he has to acquire these 15 competencies. And so next role he has to play is the leader and member of the healthcare team and system. For this, you should have these competencies. So you should be leader and member of the healthcare team and system. You should effectively work appropriately with the colleagues, respecting each one's diversity. So you have to be leader and at the same time you have to respect the colleagues' ideas and recognize and function effectively and with the cooperation of your colleagues and utilize component of the healthcare system, what are all the components and what are all the colleagues, sister, staff nurse, compounder and lab boy, and appropriately but take necessary measures. And also you have to recognize and advocate health promotion. So then about you should be able to communicate. COVID taught us how to communicate in a better way. So you should be able to communicate with the patient and not only with the patients and families, and you should be able to whatever your thoughts to the colleagues and also to the community. So you are a clinician, you are a leader, and you also should be a good communicator. So able to communicate adequately, sensitively, effectively, and respectfully in a language that the patient clearly understands. So you should be able to communicate in the patient's language and in all way. Adequately you should inform about the disease and the diagnosis you are and the treatment you are giving and what are the complications, what are the outcomes. And also you should be able to break the news. So ability to communicate adequately, sensitively in a language that patient understands, and relations with the patients and families that are positive and understanding ethical values. And you should respect the patient preferences and values. You should maintain the relationship and also you should respect the patient's preferences and values, and you should you have to involve the patient and attendants in your decision making. So these are the competencies of for the communication level. Then you are a lifelong learner. So you are committed to continuous improvement of skills and knowledge. You have to update yourself regularly. Other will be, you will be not behind. So never stop learning. What are the competencies involved in learning? What the benefits of lifelong learning is? It improves the memory and improves the self-esteem. So these are the competencies required for lifelong learner. So ability to perform an objective and self-assessment regularly and implement newly gained knowledge and ability to introspect, utilize experiences and ability to search and ability to identify, select appropriate career pathway. So you should be professional. You is committed to excel, ethical, responsive and accountable to the patients, community and profession. For this you need a broad competencies. So practice selflessness and respect, maintain the professional boundaries of your colleagues and ability to recognize meanings, ethical and professional conflicts and prescribe the ethical and legal codes and demonstrate commitment to the growth of the medical profession as a whole. So in 2023, 2 more roles were added. You should be a critical thinker and researcher. So you have to train the ING to fill in the following roles. So a leader, clinician, leader, communicator, lifelong learner and professional. All comprises total competencies of 34. So at the end, IMD should be first contact doctor of the community. So to reach the goal, they have the roles. So achieve the roles, you have the competencies. To acquire those competencies, you should have some objectives. So you know what is the goal, what is the roles, and what is the competencies. So to acquire those competencies, you require some objectives. So goal is like a target. Actually, this objective as a present, they are like arrows. So this is the difference between a goal and objective. Goal is a broad statement. Objective is a brief and targeted. And this is a goal is an abstract, intangible. And goal is a vague. Objective is a measurable activity. Goals are long term. The objectives are time bound. Goal is a less specific when compared to the objective. So why we should have an objective? If you are not certain where you are going, you may very well end up somewhere else and you will not know where you are going. So for that, we should have an objective. So what is the objective in definition is brief, concise and specific statement to what the learner will be able to do at the end of the teaching and learning activity. So this SLO means beginning with the end in the mind. What should be learned at the end after the lecture. So that should be the objective. So objectives are three types. So there are institutional objectives, departmental objectives, and specific learning objectives. So institutional objectives are to produce, they are community oriented. What are useful to the community? Departmental objectives are toward more specific issues. Specific learning objectives are specific standard methodology. Let us go through the examples. So, at the end of the MBBS course, the student will be able to provide preventive and curative care to the individuals and the community health and disease. Disease? What is this? At the end of the final year, students should be able to knowledge in pediatrics toward the managing common health problem in children. This is the department regarding to the pediatric department. At the end of the demonstration of final MBBS, students should be able to record the weight of a newborn using a liver scale with an accuracy of plus or 50 grams. This is a specific learning objective. This is a community oriented. This is a department oriented. It is specific learning objective. So this is an task. This student will be, what is this one? This student should be able to provide independent therapeutic care to the individuals. This is it. This will be department. So what are the elements of SLO? So elements are, they are audience, behavior, content, condition and degree. So AB, C square D, elements of specific or learning. So what are those elements? Audience. It describes who is the learner. Audience means who are learning this SLO. Example, first year students or the participants or the postgraduate student. So audience, it should contain audience and behavior. So what you are expected to do. So listen, define, describe, dissect, draw. So it contains A stands for audience, B is the behavior. So content. What is the content is? What he has to learn. Define hypertension, measure the height, constitute ORS. This is the subject, object or theme of the learning activity. Conditions. Describe the importance of the conditions. Resources supplied. Example, using grams time or given the complete blood count. So, audience, behavior, content, condition. D stands for degree. So, they use this as acceptable or desirable level of proficiency, at least or with the accuracy of not more than 2 attempts. So, A is the audience, B is the behavior, C is the content, D is the condition, D is the degree. So, this is the formation. At the end of the demonstration, the participant should be able to assemble a laryngoscope, angle and blade without reference and a simulated environment without error and within the 10 seconds. Who are the audience here? This is the participants in the audience. First, the behavior able to assemble. What is the contains laryngoscope angle travel, and what is the degree? It should be done within 10 seconds. So these are the elements of the specific learning objectives. Same. So this is the audience is final year MBBS nursing student. So we'll be able to, this is the behavior. This is the inner structure, endotracheal environment. Condition is as per the ASN procedure. So what are the qualities of a specific learning objects? It should be specific and it should be measurable. As you told, the goal is non-specific. Objective is specific, and you should be able to measure whether how much he has learned and whether it should be attainable. Non-attainable talks should not be given, and also it is time-based, and it should be relevant. So it should be specific, measurable, achievable, realistic, and time-bound. So, what is the drawbacks in this? At the end of the lecture, the MBBS students will be able to discuss detail the steps of performing liver transplant. So, it is not desirable and also irrelevant. So, at the end of this lecture, the students will be able to understand infection control in a hospital. It is unclear. So, saying at the end of this level, the outsurgeon will be able to perform gastroduodenoscopy. It is unrealistic and not possible. So, at the end of lecture, students will be able to grasp the significance of smoking cessation in prevention of carcinoma of the lung. This is not observable and measurable. So, these are not good SLOs. So, we know what are the elements. One, what are the qualities of SLO? Then we should be able to, what are the steps in training effective specific learning objects? First, we create a stem. The stem should contain at the end of this, at the end of the lecture, at the end of the class, at the end of our demonstration. Then add this to the stem. identify and add our audience who is the learner. At the end of the session, at the end of the lecture, the third year MBBS students then will be should be able to demonstrate. That is the step 3. And step 4 is now you are on the expected degree of proficiency. And the step 5 is condition and check. So these are the steps. First step should be at the end of the lecture or demonstrate and identify the audience, learner or the students, and what errors to be do, and what else to do in the step 4, and what is the condition. So common errors in framing the SLOs are teacher will clearly explain. Clearly is not your word to be used. And have a thorough understanding. These words you have to avoid. And also this is a condition. Given 6 weeks training endoscopy person, you can learn endoscopy, but cannot diagnose a gastric ulcer. Same parts, given parts criteria. These should be avoided in training SLOs. So words to provide, understand, appreciate, know, learn, these are not measurable. So these words should be avoided in making the SLOs. So leaving out those eye-sounding words, this is the in summary, this is the relation between goals, roles, competencies, and objectives. So to achieve the goal of MCI, to make a IMG as a irrelevant to the community, first person of the community, first contact person of the community, you should play those 5 or 7 roles. To develop those, to fulfill the roles, you have to acquire the 34 competencies. To acquire those competencies, you should have specific learning objectives. That is the relation between goal, role, competencies, and SLO. So, each one group form some SLOs.
The markers are there on your thing, and task is given within the paper right there, and then you can use the flip chart over there to explain that. ఇది ఫేజ్ 1 స్టూడెంట్ ఫేజ్ 3 అనుకుంటే ఫేజ్ 3 రాయండి మేడం ఫేజ్ 3 అనుకొని at the end of this session phase 3 students should be able to know మీకు ఏం తెలుసుకోవాలని అంటే should know the critical features of అంతే of subclavian should know the anatomy of subclavian artery branches అంటే whatever we want your students to know and మీ దాంట్లో ఇవన్నీ వచ్చేస్తాయి ఏదేది అనుకుంటే అది అంటే మీరు మళ్ళీ అక్కడ చెప్పాలి కదా
We are not asking the author of the draw the diagram anatomy. We want a specific learning objective by using those 5 steps. We boma giyandani anatomy of art. If it at the end of the first year. What is it?
At the end of the session, I ఒకసారి రాసేసాను. నా ఫ్రెండ్స్ ఒకసారి కింద మీ పాయింట్స్
Which group A? One minute. చదవమ్మా రాసావా
Relations moving and market support. Let us also play by the At the end of the session, third year articles to describe and demonstrate the behavior, the condition that the task, the type or article services capture and amendment hosted, recommend also by the mind. They should be able to perform with the available resources like paper and pen. At the end of the end of the session.
correctly is the correct degree of accommodation. Group B. Who is group B? Group Bhaskara. Bhaskar is learning.
Sir, at the end of the session, the phase 3 MBBS part.
At the end of the session, at the end of the lecture, okay.
Phase 3 part 2 MBBS students should be able to describe the anatomy of subclavian artery and brachial plexus.
First year MBBS student, not third year MBBS student.
First, we'll tell the anatomy section. Then, second SLO will be able to describe the clinical features of subclavian artery, compression of subclavian artery and lower trunk of brachial plexus by cervical rate. So, first SLO is anatomy, second SLO is clinical features.
Before you move on to your first SLO, does anybody else have any comments? Is it smart? Sir, if you don't mind.
Okay, that is
make that technical. Is it smart? Very good job. But is it smart? Smart as in not, yes. Smart as in time bound. Okay, very good. What else is not there? Is it specific? For first year student, both subclavian artery and brachial plexus. Can't you do it in two different SMOs? Do not ever be bound by that one competency, one assignment. One competency, 20 assignments. Specific. At the end of this session, the first year MBBS student will be able to correctly describe the branches of the subclavian artery 9 out of 10 times. That is my degree. Or whatever. You can decide what your degree is at the end of the session. So, do you understand what practice you do? Again, go back. Every time you look at everybody's objectives, so listen to your colleagues. That's the best way to learn. See if they meet those 4 criteria for audience behavior. All will have content, condition and degree. So, A, B, C, D. And are they specific, measurable, achievable, relevant, and time? That relevant can also be realistic. Relevant, realistic, reliable, whatever you want. So just listen to what they're doing. So do you disagree with me? Do you think that that is a better way of splitting?
Yes.
Right? Even breakup
Yes,
classes also you can
the
say,
branches.
yeah, take it down further and further. Remember, it's specific learning objective. It has to be specific. Do not keep it vague. Because then you will yourself, when you're taking the class, you'll understand that my SLO is not specific, so my class is becoming too much, my students are, the content is too much. So try to be very, very specific.
Yes, sir. So we should place the branches, no sir? Branches of subclavian artery.
That's your decision. See, and like I said, it does not matter adaptive physiology or chemistry. We are here to learn concepts in education. Specific. Try to be specific. So do you have any other thoughts?
So,
Thank you, sir.
because it contains, so there are, here this is a subclavian artery and brachial plexus, and also features of compression. For anatomy, you can divide it as a subclavian artery branches. For clinician, you have what are the clinical features of compression of the subclavian artery, and also separately you can view the clinical features of the lower trunk of the brachial plexus. So you can form these separately. And also, as I told, the conditions you can apply. Group 3.
Identify and describe the describe and draw microanatomy of pituitary gland, thyroid gland, parathyroid gland, tonsil, and tonsil, epiglottis, cornea, and retina. At the end of the session, the first phase MBBS student should identify the pituitary gland has to identify where it is and draw anatomy, and should be able to draw the microanatomy of the gland, and then functions of pituitary gland, the histology of pituitary gland, the nerve supply, and blood
Okay, I'm going to stop you.
Yeah.
Already I have to stop you. Does anybody have any comments on group 3?
So you are making too many.
Not specific.
Not specific.
See, these are tracks. The National Medical Council has written these competencies to track us. They were testing us. Can you recognize? Look at this competency. How many things are there in this? Okay. So, I'm sorry, but that's how it is. We are very open about it. And it's written down that book full of things like this, which are very, very difficult. That is just to make our lives as educators more interesting. We have to put in the effort. Try again. Try to follow your SMART and ABC. This is a very important exercise. So that's why I'm stopping. Please try.
So simple formation is at the end of the first year MBBS, the student should be able to draw the, this don't give it identify this, draw the microanatomy of pituitary gland correctly. If the two attempts are not everyone. So split them. Don't draw the microanatomy of pituitary gland. Leave this thyroid, hypothyroid. Then you can form this missed thyroid, separate SLO, parathyroid, separate SLO. That's why you should be specific. Draw the microanatomy of the pituitary gland. So then it will be specific, like in doctor. Next. Group B. These competitions are in your group itself. The number also I have given there.
and function of a neuron and neuroplayer. Discuss growth factors and other growth factors like cytokines. My SLO is at the end of the lecture, first year physiology student who is the audience should be able to draw the structure of the neuron and describe the function of a neuron and neuroplayer in 600 words in 60 minutes.
Okay. That is one SLE, you can ask you to form 2 or 3. It's okay.
Describe the functional anatomy of heart, including chambers, pacemaker tissue, and conducting system. So, by the end of the lecture, first year MBBS student, I want to split into 2 SLOs. One will be around functional anatomy, chambers, valves, and the heart sounds. And the other one is about pacemaker tissue and conduction system. So, they should be able to draw the anatomy, describe the chambers function, blood flow, valve functions, and the heart sounds and S1, S2 in one lecture by end of the lecture.
At the end of the lecture, the first year student able to write the anatomy of the heart. You can say are including chambers, but sounds are different and pacemaker tissue conduction system you can put together, but sounds will be different and pacemaker will be different and anatomy different SLOs you have to form. This is anatomy student, that the audience is the first year MBBS students.
Just before you move on, how are you measuring your objective?
So the degree should be added to the
What does that mean? If I draw 3 chambers, is enough. You will draw all 4 chambers. How many times? In how much time? In 5 minutes, they should be able to draw 4 chambers. Is that understandable? Okay, or 1 hour to draw 4 chambers. That is one. So don't forget the degree. Without it, it's irrelevant. Otherwise, if it is degree, for 20 years. You have to have a kind of measurable idea. Only way to measure such things is able to draw is not measurable. Able to draw correct and able correctly. Out of 5 labels, 4 should be correct. You understand? You have to be very objective.
Question is describe the anatomy, functions of middle ear, inner ear, and legs. So SLOs and dividing into one. First one is by the end of the session, the first year MBBS student should be able to describe the anatomy of middle and inner ear and middle. You should be able to draw and label it correctly. Second SLO is second SLO is by the end of the lecture, the first year MBBS student should be able to describe the functions of the middle ear in 5 minutes. 5 minutes. All the
lecture you have just listened to it. Now we are forced to learn. That is the difference between traditional model and present model. Earlier just we listened and now you are participated. So I have made you to learn forcibly. This is the method of CBL. So by this time the party should have learned Wesley. Okay, thank you.
Some more appreciation to sir, please.
So thank you for giving this opportunity. Thank you to Sophia and all.
Thank you, sir, for a wonderful session. Next class is by Dr. Ravi Kumar, sir, on teaching and learning methods, including interactive large group and small group methods.
While he's setting up, I'm supposed to summarize at the end of each session, but we're running late. Any other questions? No questions? All clear about goal, role, competency, SLO? So in our daily practice, when we are teaching, the most important thing for us is the SLO. That's because the entire goal is very large sometimes when you get lost in the idea of coming. When we finish MBBS, did we meet all the goals to think that I didn't see that? Difficult. I don't think I did. Was I a Christian first contact? Yes. In a rural hospital, I was able to do normal delivery. Yeah, but was I able to diagnose psychiatric conditions? So look at what an IMG means. What's our goal? Their goal will be I want to be international cardiologist. That's good. Let them have that. What is our goal? Is those 7 things. And towards that, we do all these objectives. So again, smart and ABCD very important.
Good afternoon. You have seen this. What I was trying to step out. So black and white cannot go together. So what are our so this is what our practice is about. So what our knowledge is. If you see black and I don't know. So today we will start with teaching learning methods. So at the end of this session, should be able to list all the available teaching learning methods, use the principles of interactive learning, and understand the role of the faculty, the changing role of the faculty from an information provider to a facilitator. So open your mobiles and go to slido.com and enter this code. Slido.com. You will see this. Slido.com. And answer that question. There is a list various teaching learning methods. So next step, SDL. You can see the responses here. Group discussion, group sessions, seminars. Group discussion, small group teaching, Just visual aids, SLO, small group discussion. Group discussion. Internet. So these are the various teaching learning methods: lectures, small group discussion, seminars, symposium, workshops, website clinics. Next, simulations, role play, audio aids, film, demonstrations. These are the various teaching learning methods. So these teaching learning methods should be used based on the domain, group, and the context. So based on the domain, cognitive domain, there are lecture, panel discussion, symposium, teaching, teaching, etc. For psychomotor domain, simulations, website clinics, DOAP, workshops. For affective domain, role play is the one. Next, demonstration, other video show, movies. So these are the various teaching learning methods for the domain, based on domain. Next, based on group size, for large group, we go with lecture or panel discussion, or symposium. For small group, we go with small group discussion, workshop, seminar. Same with the individual study. Can be self-study, counseling, and project work. So what are the innovative teaching learning methods apart from the traditional teaching learning methods? Case-based learning, problem-based learning, these are the innovative teaching learning methods. Next, flipped classroom. Next, e-learning, storytelling, and experiential learning. These are the various innovative teaching learning methods. So what is the most common teaching learning method? Here following. Yes, lecture. So lecture is nothing but to read. That's all. So it works against human brain, but our brain needs some activity. So what is the big advantage of the lecture? So whatever the group, whether 50, 100, 150, 250, 300, we can go with the lecture. That is the main advantage of the lecture. So for 250 students also, we have 250 students in some medical college. For 250 students also, we have a lecture. We don't know who is listening and who is coming to the class. So but this is the biggest advantage of the lecture. So other advantages of lecture are we can give new information, unlimited information, up-to-date information, everything in a short time. So what are the limitations of lecture? This is a lecture for 100 students.
So lecture completed. So what are the limitations? So it is a one-way communication. We don't know who is listening and who is. There is no interaction, and the information is given. That's all. They don't know about what is happening with the students. So insufficient interaction. There is no chance for assessment. So why make it interactive? So when a lecture starts, everyone will be active. As the time goes, the activity decreases, and at the end of the lecture, there will be no interest. This is the common time span response for a lecture. So some will be sleeping, some will be playing. These are the limitations of the lecture. Now we will see what is the role of faculty in a medical college. So go to the slide. And please also list various roles of the faculty and medical college. Teaching, instructor, guide, mentor, observer, clinician, yes, lecturer, clinical demonstration, communicator, so these are the various roles of the faculty. Teaching, instructor, lecturer, leader, observer, supervisor, communicator, clinician, mentor, guide. So these are the various roles of the faculty. So the changing role of faculty from just information provider to a role model. Next, researcher, administrator, and also as a basic scientist. So these are the various roles. Just from information providers, we will be providing the information to students, and we will be developing resource material required for the students and planning the curriculum. Next, assessing the curriculum. Next, we will play a role as a facilitator for increasing learning and awareness, and finally becoming a role model for the students. So these are the various changing roles of the faculty, just from information provider to a role model. So now we will do an activity. So each group, so make pair with the person sitting next to you and think about interactive way of teaching. Okay. And then share your interactive teaching method with the group. And one faculty will write the interactive method on the board. Come on, think about interactive ways. for a large group. Anything else that you know? Use your competency from the previous session. Use the competency from the previous session. Use your competency from the previous session. Finish, we'll start from group A. Group A. Mike.
Lectures and seminars.
Interactive teaching.
Group discussions.
Group discussion. Next group. Group 2. Group 2.
Pictorial communication. Yes. Pictorial communication.
Pictorial communication.
Okay, do next.
Next. Regularly asking questions. Okay. Regularly. Next. Questioning. Next group. Feedback. Taking feedback. Next.
About the topic, and then we can ask them to answer those questions. And then after the lectures, we can ask them again to post it.
Okay. Next group.
Quizzes.
Okay. Now we will see various interactive lectures. So why we need interactive teaching? Because interactive teaching becomes active. There will be active involvement of the students, faculty with the content and resulting in 360-degree learning. So what are the various interactive techniques? So small groups, breaking the class into small groups. Next, questioning. Next, using clinical cases, written material, audio visual aids, organizing debates, group discussion. So asking questions. So what happens? When you ask a question, there will be active involvement of the students. Those who don't talk in class also, they will try to listen. What is the question? So it will increase the interest in the topic. So it can be used at the beginning to become familiar with the topic, to test the knowledge of the students, or at the end to test any gaps in the knowledge. So what type of questions we can ask? We can ask it straightforward questions, or we can go brainstorm. So we will give a question and the students will list some answers. So brainstorming also can be done at the starting, in the middle, or at the end. And the timing is important because it depends what is the state of the students and mind. So rhetorical questions. We will ask the question merely for the sake of the evolving interest, not expecting any answer. Next, surveying the class. Just asking how many of you had breakfast. With that question, we can increase the interest. Next, present short questions. So these present short answers will check the students' involvement, learning, and identify the gaps. So to point out gaps in understanding, testing students at the end of the lecture can be helpful to increase the retention of the knowledge. Next, MCQ questions. So the same purpose. This MCQ questions also to point out gaps in understanding. Next, photo, films, and videos are a photograph. So this photo tells what is the limitation of a lecture. So next, using flip charts, audio visual aids. Next, audience score. So we will give cards, color labeled cards or number labeled cards, and we will ask questions. Students will raise the charts. Simulations, role plays, and debates. So these simulations are very helpful to simulate a real life scenario. So if we give a real life scenario, what will this type of clinical aspect we can test and we can demonstrate to the students by using simulations or using a simulated patient. So before starting the session, we can give written materials and ask them to read, prepare, and come. Then we can discuss in the class. That is also one method. And also incomplete handouts, where we will give handouts which are incomplete or there is a space to write. So student will read, understand, apply his knowledge, and fill up those gaps. In this way, students can retain knowledge. Next, the most common method of teaching we are using is use of clinical cases, real cases. So this increases the students' interest, participation in the learning, and is the most effective method of demonstrating for psychomotor and effective learnings. So the clinical cases can be a brief case description where we will stop the case description and we will ask the students about their hypothesis or inference or opinion. Next, cliffhanger cases. Here, we will give the case and we will stop at the decision part. And we will ask the student what you will do if you are there in the situation. So suppose the patient comes to a casualty with so and so illness, what do you do? So these are the types of simulated cases or real cases or simulated patients we can use. Next, incident type cases. In this type, we will give case. If the student asks the right questions, we will provide more information about the case. So by using this type of cases or simulated patients, we can increase the interest in the subject and there will be good retention of the knowledge. Next, audience responses. Using computer technology or internet, like the one we just used, Slido. There are various equipments are available for taking this audience responses, but the drawback is you have to prepare before and you have to give adequate information about the procedure or the equipment we are using. This is the main drawback. So this was the response last year for a lecture from 8 students. So they have given some responses. So very useful, gives us the chance of applying the knowledge. This is their feedback about the class. So some gave, so it would be great if it was slower. The class was good, but we didn't go through other groups. This type of feedback we don't expect when we really talk to the students. But if we use these system responses, interactive response aids, we can get the response. Here, the main benefit is the student can remain anonymous. So, that is the biggest advantage, anonymous. This is another response. So, prefer more time was given to take the notes. It was nice, but it would have been better.